According to the Epidemiology Unit of the Ministry of Health, in 2022, there were 33,243 new cancer cases reported in Sri Lanka and 19,145 cancer-accounted deaths. Most of the cancer patients recorded were between the ages of 40 and 70. The most common cancers in Sri Lanka include breast cancer, cervical cancer, oral cancer, lung cancer, and colorectal cancers. Cancer can occur in a body due to multiple reasons. Smoking, use of tobacco, betel, and alcohol is the most common and most significant cause of mouth and lung cancer in Sri Lanka. Smoking, obesity, and physical inactivity are recognized as risk factors for breast cancer and colorectal cancers. If there is a significant positive family history, such as many family members being cancer patients, or if they are having cancer at a younger age, that may also increase the risk of having cancer. Occupational exposures such as asbestos, silica, and radon, plus living in areas with polluted air, can also lead to lung cancer. Cancer is the second most common cause of hospital mortality in Sri Lanka, accounting for 14% of all hospital deaths. However, most cancers are preventable. It can be treated and cured if it was detected in its early stages. Here's how you can prevent and detect cancer before it's too late. It's not over yet. Avoiding the use of tobacco, betel, and alcohol, reducing the exposure to secondhand smoking, can decrease the risk of getting cancer by a greater amount. Having a high-fiber diet with fruits, vegetables, and whole grains, and limiting red meat and processed meat helps a lot in reducing the risk of cancer. Maintaining a healthy weight and regular exercising can also help in preventing cancer. Maintaining occupational safety protocols in places with the high risk of lung carcinogens will reduce the risk of lung cancer. If your family has a history of cancer patients, you might be at risk too. In this case, it's best to go to the nearest hospital and perform a health checkup. Most cancers are detectable at an earlier stage. Keeping an eye out for these symptoms will help you detect them early. If you notice these symptoms, please go to the nearest hospital or doctor. They will run some tests to determine if the symptoms are related to cancer. In mouth cancer, non-healing ulcers or white or red patches in the mouth, persistent pain or difficulty in swallowing, lumps or thickening on cheeks, and numbness in the mouth or tongue are some of the most common symptoms. Most breast cancer patients display the following symptoms: painless lumps in the breast or armpit, changes in breast shape or size, nipple discharge, retraction or scaling, and the skin dimpling over the breast are some symptoms among them. In colorectal cancer, changes in bowel habits, blood or mucus mixed with stools, unexplained weight loss, and fatigue are observed among the patients. When it comes to lung cancer, persistent cough or coughing up blood, shortness of breath, chest pain that worsens with deep breathing, and unexplained weight loss or fatigue are some of the most noticeable symptoms among the patients. If doctors suspect you have cancer after running the initial tests, they will then send the samples of your cancer lesion to a pathologist. Pathologists are trained and specialized in identifying cancer cells in a body. They take a tissue sample from the cancer and run them through some tests to identify its nature. Then they can confirm whether it's a cancer or not. Most cancers are curable if identified at an earlier stage. If you keep an eye out for possible symptoms, cancers can be treated early. If your friends or family members display these symptoms, inform them, support them, and convince them to seek medical advice immediately. Thank you.